when the pandemic started, nobody knew its magnitude. Nobody knew how fast it will spread around the world. As you would recall, in the month of April and May this year, when we had this second wave of the COVID-19, the rapidity of the pandemic, rapidity of the cases was enormous. And any testing center would find it very difficult to cope up with this situation.
For a country like India, there are labs that were testing 300% of their capacity, causing test times to increase to 4 to 5 days from the normal 1 to 2 days. There was an extreme shortage of manpower because of the high rates of infection that we saw. Some labs had a shortage of tests, but others had a shortage of high throughput machines that could process more and be reliant on less manpower.
Initially, the amount of manual labor which was involved in testing was humongous. I mean, we had people working in 2 batches and they would be exhausted after testing about 100, 200 samples because it was really a laborious process.
Global Fund and FIND co-lead the Diagnostic Pillar of the Access to COVID-19 Tools Accelerator, or the ACT Accelerator, which essentially aims to improve equitable access to affordable tests. We wanted to support high-volume public sector labs in India, and we donated 2 types of machines till date. So RNA extractors, which are high throughput, and automated RT-PCR machines. One of the sites is, of course, the THSTI, which is a very close partner and really a testing hub in this area.
Initially, it would take us pretty much 8 full hours to process at least 100 samples. So our turnaround time from sample receipt to delivery of results, it was close to 2 days. Now we have the capacity to almost process about 200 samples in less than 2 hours. So our capacity has increased to more than 400 samples in 8 hours. At the same time, the involvement of manual labor has decreased. So people are very happy that they are contributing, but at the same time, they are doing it by using the technology with these high throughput machines, which I think is very satisfying. Every personnel who comes has to go through the process of training, and there's an evaluation process for really assessing their competence and then certifying that this person is fit for purpose. We have now devised a system where everybody who comes actually learns how to use the machine and also understands the processes, the quality processes of analyzing data and submitting reports. So we have a system which is working well, I would say.
We also donated machines to other states and other sites which are in places like Maharashtra, Tamil Nadu, Madhya Pradesh, Uttar Pradesh, Mizoram, really trying to spread out our support and also ensure that we can really target some high volume testing public sector labs. What we've seen in the previous waves is that to ramp up COVID-19 testing, a lot of capacity has been taken over from the TB labs, from the HIV labs, from the malaria labs, causing a disruption in testing to other infectious diseases. So my hope would be that we can ramp up COVID-19 testing in India so that in the next waves we don't disrupt other infectious disease testing.
Much more than before, it's a unified word, it's a globalized word, it's a globalized village. So I think test is something that is of utmost importance, essential in every corner of the world, so that we know which are the hotspots, where the virus is emerging, where are new variants coming up, what's happening, which population is more affected, so that adequate control measures can be taken. Right now, it's a global effort, and with this global effort, I'm sure humans are going to beat the virus soon.